Thank you all for being here on time. As you can see, my co-host is supposed to be here, but we were sort of waiting for her. But I'll just kick start the show anyway. So, Lady Abner is going to join me in a few minutes' time, but I can. The doctor is here as well, so we'll probably just kick. Yeah. So just to go over like some sort. Hello. Hello. Sorry. Technical issues. So yeah, just to kick off the show, my name is Akos. I'm one of the resident doctors here. Thank you all for coming on time. Obviously this is the OT Health Talk. It's sponsored by Taptap Send and also OT Media. So thank you so much for being here. Today we've got one of our very frequent doctors here with us. We've got Dr. Blessing Prah with us. You Blessing, you like to go by another name? I can't remember. What was it?
Baden.
Bade, that was it. So I think that's your middle name, isn't it? So yeah, he's a registrar. He's an orthopedic registrar. So he specializes in sort of bones and muscles. And today he's going to talk to us about calcium vitamins and vitamin D vitamins and how they affect your sort of your bone health and your muscle health. So yeah, Dr. Biden, are you happy to sort of kick off and start the show? Tell us a little bit about yourself. For people who don't know you, for people who've never met you, tell us, give us your full name, give us one interesting fact about yourself, and then yeah, and then you can start.
Of course, you like putting me on the spot. You know that.
Yeah, well, if I don't, who's gonna do it,
But
eh?
but I think like most people know me here. I stand to be corrected,
For
but
those who don't know you, it's not everybody.
okay,
There's some new people on the show, right? And welcome to anybody who's new. Happy to have you here.
okay, all right. I am Prah Blessing Baden. In case you want to know how I like to arrange my name, it's Prah Blessing Baden.
Sorry.
In case
Wait, what's your first name? Is your first name not Blessed?
yes, it is
And is
Blessing
your last name not Bra?
Prah.
Uh-huh. So
But I love to be called Baden at times. So
okay, Proud Blessing Baden, got
that's
it.
Baden, yeah. Not too much. TikTok, 6 feet tall, I think, and handsome. Single.
Jude too. Single and searching. All
Again,
right.
uh, and
Right,
pretty
thank you.
much.
Yeah, tell us about you.
I think you made earlier on, especially in bones and muscles and stuff. So I think that's pretty much for now.
Okay.
Yeah.
Brilliant. All right, yeah. Get kickstart. Just tell us what
Okay.
you're
Thank you
gonna
very much
discuss.
for giving me this opportunity once again. And I always say that our coach is very smart in like choosing topics and then what have you. So I was so happy with the topic that he gave me, and it's just full of work, like to prepare here to do your maximum best and then like give to the people as well. Uh, I hope that this time you'll be able to have a smooth discussion in a smooth presentation, because the last time there was so many backlash. People beating me on the show about painkillers and stuff. So I think today we will have a good, we will be in a good level like today.
Don't worry. Speak freely. Speak freely. You're right.
So now, the topic for like today is like calcium and then like vitamin D supplement on bone health. There are so many like minerals or so many like vitamins out there, but I don't want to go or shift to someone, so I will do my maximum best and then like go to the topic that I was given. I love to be that person that I stick to rules and and then I speak to the specification. So I'll try my best and to be on that path very well. So now, before I can start, before we start, let's try and define what is vitamin, and then I think like by the definition, it will help us to establish a goal. So what is vitamin? Pretty much vitamins are they are nutrient as well as many nutrient we have in the world. They are nutrient that helps that the body needs to like perform its function and still like healthy. There are several like essential like minerals out there or essential vitamins out there. As I said earlier on, I'm not going to go much. I'll just stick to what I was giving, both the calcium and then the vitamin B supplement. So the calcium and the vitamin B are very important in maintaining bone density. And then what do I mean bone density? A bone density is the amount of calcium and then other minerals in the body. So if there are enough mineral, if there are enough of calcium and vitamins in the body, we tell that's what the bone density. Now, in the bone density, it helps to indicate what the strength of the bone. So if there are not enough strength, there are not enough nutrient in the body, that's when the bones are predisposed to like fractures anyhow. With a little slip, with a little pull, you get fractures. But if your bones are able to like withstand like forces and other stuff, and then a bone fractures, it means that yes, there's a lot of nutrient in the body. So we term as what? A bone density. So now, like, can we measure the amount of the strength in like in your bone? Yeah, pretty much. We can measure the amount of strength in like or the amount of strength in their bone. Pretty much back home in Africa, and once again, I'm not trying to look down upon my continent, but it's very rarely seeing people like coming to the hospital. Doctor, I want to check my bone strength and stuff. But back here in Europe and then where we live in the various European countries, Asia, in Europe and stuff, people do check all these things because the white people they are very keen on their health, they're very keen on their how they live their life. So that's why we see them growing strong and fit. Yeah, but just by the way. Now, if you are, I was doing something once I was like preparing for my topic, doing my research. I come to realize that now most of the time doing the checking like of the bone density, mostly we do check them on the long bones, and then like one of the place we do check mostly is the hip. And then now, research like tells us that now the strength, an average strength or an average bone density in this hip bone, it is as strong as the beam. I don't know those in like construction or in engineering. After laying our blocks and then bricks to some extent, we put some concrete on the top of the bricks during the latter part, and that is called beam. According to research, the hip bone is as strong as a well calculated beam mixture or like a beam on the top of a building. So you can imagine how strong it is. Even how engineers struggle to break all these beams when they are destroying like buildings. So you can imagine how a well healthy bone will look like. Now, what are the factors that can cause a low bone density or cause the depletion of calcium and vitamin in the human bone? One, like it's mostly by age, and as human, once we grow and once we age, our bone loses its density. People in trauma and orthopedics will tell you that once you get to 40 years in men and then like 35 years in women, every year you lose 1% of your muscle mass. So that is why it is quite like encouraging for you to always like build, like go to the gym and going to the gym, exercising, keep or help maintain the muscle. And even muscle, the muscle grow. The more you use the muscle, the more you grow. And this might not those in. I was listening to one like podcast and one recent, and it was like the person who happens to be a sex like therapist or something. He was like people who want to get into, let's say, large penis, sometimes he encourage them to do what, like masturbating or like pulling their penis. It is a way of what, like increasing the size. That happens to be the natural way of what, building the enlargement of the male part. So in the same way, once you don't use the muzzle, once you don't use it, muzzle is what goes down. So that is part. Another factor that will contribute to low bone density, it is like a history, like family history about bone diseases, like genetic disease. It can help you. For example, osteogenesis, like imperfecta. I'm not going to go much into the physiology or the biomechanism or everything, but that's what I'm saying. Then another factor that contributes to low bone density, it is like smoking, alcohol use, like certain medications, like the steroids and then like, what have you, other like medical conditions such as the RM, which is the rheumatoid arthritis, can help you like cause like low bone density in the human body. Now, what are the prevention to do away with low bone density? Of course, ensuring like adequate calcium and then like vitamin B supplement. Now, please like underline the word adequate. As time once we move on like to the presentation, the word adequate will be very very important in our presentation. So how to prevent low bone density? Adequate amount of what? Supplement, which is the calcium and then the vitamin. And also intake of like regular weight lifting, exercising can help you like prevent low bone density. And then some medications can also help you prevent low bone density. Now, how do we test for bone density? As I told you earlier on, in case you have the energy, if you have the money, if you have the resources, like I really don't know where most of my listeners are coming from, but I know most of you are in the UK. I really know much about the system over there. Like every country has a way of like have their medical protocols and stuff. If you have the chance, if you have the energy, please go and check it. It is free. It is It is painless. It is non-invasive, and you can do it. Go to your GP, go to your doctors, talk to them. In case you're having any signs of like feeling like having low bone density, you can go and do it. It's very simple by texting. Some of them use X-ray, like some of you the DEXA to check for all these things. Or these are like medical terms. Once you approach your GPs, approach your doctors, they will like explain to you. Now, when can one check his or her bone density or like calcium people level of the bone density in human? Mostly like medical practitioners encourage that women above 65, 60, like and should always check, and the men within their 70s and then above 70 should go and check their bone density, because during that stage we know that age has catch up. Most of you, that age we have passed our menopause and the andropause and stuff. So that on that part, age has set in, so we need to start checking the stuff. Now, I want to go into a little bit, not to go into the details, but give you like a suffix of how like bone grown, because there is a misconception that this calcium and the vitamin help in bone growth and then bone healing or whatever. You as I said, I'm not going too much, but I'll just give you the details. Now, there are two types of how like bone growth. We have the longitudinal growth, and then the like thickness, the apposition growth in bones. Now, what is the timeline? Like when does our bone stop like growing? It's very important. And then I don't know, during my days in medical school, during my anatomy class, I was told it's 18 years. see, day in and day out, there are research, there are things going on every day now and then. So going during my days, I was told it is 18, and now once I did my presentation using the like European like group of orthopedics, and then American, the American, they were like in typically in 18 like in females, and then in 21 in males, bone stop growing. But for me, for example, using myself for example, I think when I was even 26, 27, I can see that I'm still growing in like in length. So I can see that my bone is still growing because every year, every 2 years, sometimes like I check my length, I can see that there's an increment every now and then. And then that is that. And then once again, there are mainly like cells involved in the bone growth. You have the osteoblasts, the osteoclasts, and then the chondrocytes. As I said, I'm not going to go into the mechanism, and I'm just giving you a brief surface. I'll tackle the main thing. Now, this is very important. What is the role of this calcium and then the vitamin in fracture healing? Now, there is a conception that calcium like is the main component of bone and essential for mineralized or fractures. Those called the callus in terms of trauma orthopedics. That's what we call it, like the bone formation. In case there's a fracture and then there's a fracture start healing, you see a new bone formation. We call that as callus. Now, the vitamin D is crucial because it helps the body to absorb the calcium in the form of diet. Now, during fracture healing, the body like mobilize large amount of calcium. If like dietary and stored levels are insufficient, this helps you to memorize or to absorb the nutrient in help for me. So basically, there is a misconception that this vitamin and stuff help you, but if you have the right amount in your body, you're good to go. You don't need to take extra amount of calcium and then vitamins in. Now back to our main topic: the calcium and vitamins on bone, vitamin supplement on bone health. Now, how much should you take, or too much of vitamin D may once again harm the bones and then not help you? There are several research going on. So now the question is, what is the amount of minerals or the amount you should take in the body? Now, I think during my previous topic, there were like questions about vitamins and what have you, and I was like, I don't agree with young adults or young people start taking maybe vitamins D or any vitamins and stuff. Once you have the right amount of food, you are good to go and what have you. So now, people often assume that if some is good, more is better. So people say, okay, once I'm taking this vitamin and then this vitamin is helping me like to support my bones and stuff, that means I should increase the dosage. I should take it more. Now, the more use of it can in turn cause so many like diseases. Some of them like kidney stones, can cause like muscle like problems and what have you. So please know the amount, know the right amount of bone nutrient you have to take in your body. So once you visit your pharmacist, once you visit your doctors, they can tell you the amount of stuff to do. As I said, in every country, the protocols are different. Even in the same country, in different hospitals, the protocols are different. In the same hospital, in different departments, the protocols are different. In the same department, every doctor has what he or she will prescribe to you. So please, I have my values here, but I'm not going to give you the values so that, okay, you will say, okay, Dr. Blessing said, this amount or like this dosage is good for me. As I said, every country, the protocol varies here and there. So please, if you want to take any vitamin or any prescription or any drug, please do your minimum and then visit your doctors in the country that you live, and then they will help you with the protocols in that particular in that country you find yourself. So please, often good. Taking vitamins are good. Taking minerals are good. But please, the dosage is very important. So people assume, okay, I'm taking this amount of drug, this amount of dosage is helping me. So why not then? Why not increase the dosage? It in turn cause like problems to you. Now, now this is why I always like prove to you that taking like adult kid from the 18 from childbirth to 18 years, if or 25 years, or even your 30s, if you don't have any like bone like problems or any like genetic problems like regarding the bones, I do not agree going starting from vitamins and all these things supplements if you're having the right amount of like nutrients or diet. Now, for example, like if a child, let's say in his 9 years, 10 years, 15 years, 18 years, have a fracture, let's say a wrist fracture. Here, where I practice, we usually put cast on the wrist, plus or minus like 3 weeks. And then after 3 weeks, like if you go for X-ray, you will see like callus, you will see bone healing, you will see new bone formation already forming in that kid, in that 9-year-old kid, in that 10-year-old kid, in that 15 years or 18-year-old kid. Now, let that same fracture happen in a 40-year-old, 50-year-old, 60-year-old. We put 5 to 6 weeks of casts. And even after removing the cast, you will see that there is or there are no complete bone healing or what I say like callus formation in the kid. Why? Because at that age, the nutrient in the bone is not enough. And as I said, like in my previous was in the beginning, aging is a major factor of low bone density. So that other 50 years, other 60 years, other 70 years, and the minerals needed for faster bone healing are lost. This is where the osteoporosis comes in, where your bone becomes low in bone density, and then every little push or every little fall, you have a fracture. And then that is that. So please know the timing, know the aging. It's very, very, very important to take the thing. Now, too much of a good thing. Now, there are some people that said that encourage people to take as much as high amount of vitamin D every day. As I said in my previous, I do not recommend that. See your various health professionals, and then they will help you do that. Last again, let me give you the last back home. I know like people have a lot of topics when it comes to like topic like this. So before I want to conclude, I want to say that when it comes to vitamin D or calcium, there are some simple like plans you should follow to protect your bones. Please, brothers and sisters, stick to the moderate amount. Like, do not try to be wiser than your doctor or be wiser than nature, because too much of everything, as we know back home, or we know from our parents, from our grandparents back home, like bibia and I'm not do bibia we required. So please know the amount you have to take is very, very important. Now, if you take too much, you get a hypercalcemia. Now, this hypercalcemia will in turn affect you in one way or the other, causing like muscle problems, like causing like kidney problems, and then what have you. So please know the amount you have to take. And also, once again, good food sources include like good food is very important. Let have our well balanced diet, stick to our nutrient, like go to the exercise in the body. As a sports doctor course, I know like for today, she will agree to me that please you need to like move your body. I know today he will not bash me as she bashed me when it comes to the painkiller. Today he will support me that please, if you want to increase the strength in your bones, please do your minimum best and then like move your body. Have a good diet. What do I mean good diet? Having your fatty fish, the salmon, the tuna, the sardines, and your other food, the milk, the cheese, and then the yogurt, and then your cereals. Any natural food you think can have it, or veggies and what have you, please have them. Last conclusion, please. The minerals, the vitamins, they are very good to the bones. Let's have them. But please, you should have them one at the right dosage and then at the right timing, which is very important. Thank you very much. I'm seeing blessing. I hope like I didn't say anything harming again, please. Thank you very much.
Yeah. No, I don't think you said anything. I know you're on mute, so if you want to. Oh, you can't unmute yourself. No. Yeah. You have to figure that out yourself. But thank you, Blessing, for that talk. I don't know, host, can you please unmute Abna? I'm not able to do it. Yeah, there you go, Abna.
Yeah, I've got my voice back. Yes, thank you, Dr. Blessing. Thank you, Dr. Blessing. I hope you are not in trouble as well. I hope that is a term of enduring. And
You're not in trouble with me, so you're all right.
from Auntie Amma. But anyways, yes, ladies and gentlemen, once again, I want to apologize for coming on late. As usual, as you know, it's end of month, so it's quite busy at work. Yep. So we will now have a quick commercial break, and then when we come back, we'll do the Q&A session. And as you know, you can ask questions based on today's topic or any health topic. So please do stay around. We'll be back soon.
So physical money and pretty me do rap just for me send jam in a minute in Sabacandia and then one Taptap Send.
Yeah, Ebusiafo, we didn't did an akuma patchlewa one. They recommended Taptap Send amamo. And that's our for also for baby. Now basa. Our rating so yeah. Our A1. Into a piano do Taptap Send. That all says it can for Taptap.
You're going to do check a man, you're going to do check Gala for say. You are going to near this coffee here. May and friend for the VR, you will tap at the move you are. Taptap Send in this street.
The Taptap with the one.
Taptap and one in a
Piao.
Hello, this is Lawyer Wisdom of Wismart Solicitors. Join me this and every Friday on OT TV from 8 to 9 p.m. for all your UK immigration matters. I hope to see you there. Thank you.
And hello, and welcome back to the OT and Health Talk Show sponsored by Taptap Send. So for those who don't know me, by now my name is Avina. And Dr. Blessing just talked us through the importance of vitamin D and calcium for bone health. And so now we are at the Q&A session. So as I mentioned earlier, during this period of time, you allow you or the audiences bring your questions to the doctors, and obviously you can ask questions based on today's topic, particularly, or you can ask any other health question that you have. Dr. Blessing can help you. There are various healthcare professionals amongst us who can also chip in here and there. And so, without further ado, let's start. I will probably get it going, Dr. Blessing. I was, as you were doing your speech, should I say your session, the first question I was going to ask was I feel like calcium, particularly for me, is one of the really difficult ones, except for milk and cheese and maybe dairy. What else can you get calcium in? What kind of food can you eat that can help you get calcium and vitamin D? Actually, yes, yeah, vitamin D as well. These two are very difficult for me in terms of diet. So I know you did mention like the dairies, and you all mentioned sardine cry, which I was happy to hear. But if you could just give us a few foods that can give us these two particular vitamins. So.
As I said, the dairy products are very, very important. The cheese, the milk, the yogurt, and what have you, they're very, very, very important. The veggies as well, they play a very, very like major role. And no, you see, all this food that I'm talking about, they help. But like one food, like eating one food alone, like will not do the justice or will not give you this. Okay, like vitamins work hand in hand. Okay, once you eat this will help you like do that. Okay, once you do this or once you eat this will help you like do that. Now, taking, let's say, vitamin D alone or taking calcium alone, you don't get the effectiveness of it unless you include vitamin D. So actually, I was like, I coach is a very, very smart person. He knows how to choose topics. I don't know if you were late, so you didn't hear that part.
No.
Person, sorry for putting you on the spot, of course, even I worries you. But he's very smart. He knows the topic to choose. He knows the catchy ones that to pull the audience or to pull people, like to grab people attention.
Thank you. You're giving me a big head.
So eating one food alone, like, okay, every day, protein. Even if someone who is a gym, someone who's a gym person will tell you that always, like the protein help you in building the muscle and stuff. But the gym people say, like, if you eat only protein alone, no, you have to include your fibers, the cereals, all these things help. So, like, eating the calcium alone will not help. So you need to like combine this vitamin and then have a very, very good bone, a good health body function.
Okay.
So your veggies. So answer the question. Your veggies, like eat the veggies, like eat the product, the cheese, the yogurt, and the milk and what have you. Good.
Fantastic.
But once again, don't do it too much. Like. Adequate is very, very important. Thank you.
Thank you very much. I think one day we'll get if there's a dietitian plus the doctors here. So as you guys, you'll be very, very good because like so that we can link the two very important ways together. For some reason today the audience are shy because questions are not coming. Anyway, I have one to ask. So basically, that bone health issues tend to develop very silently. And maybe I was late, or maybe you did mention it, and maybe I had to like quickly get up to go do something. But what are the warning signs people should watch out for? Developing bone health issues are quite silent.
Oh, good. All right.
Mm-hmm.
When it comes to the warning signs to know that, okay, like maybe like my bones or my bone is weak or like your bone is weak, like multiple fractures, like any slip, any small fall, the person got a fracture. Maybe let's say like a 12-year-old kid will do the same thing that a 50-year-old will do, and then you will see the person have a fracture. So that's why for me, I do not encourage people, it's called like trampoline or something.
I think it's trampoline.
Yeah, no, like
when you jump. Yeah.
Exactly.
But it's fun.
It is fun. But I've seen people in the ER, okay, yeah, the doctor, what happened? I ask you, what happened? Oh, like I and my kid were playing on the example from next month going like the summer. and then like fracture. Things are so common, you know. People be going out playing, and you be seeing how to say like stupid things, bringing them to the ER, anything. You have what doctor? Oh, I and my kid were playing on the trampoline. The kid we didn't have anything, but after the woman came, I was like, we were doing the same thing, but I felt like a knock in my.
Oh no!
That is why I'm coming to check if I'm okay. We did an X-ray, there is a fracture. You understand? So, all is told now. There are warnings. And any small thing you will do, you have it. Especially at times, women after the 40 years or after they are like during their menopause and stuff, like osteoporosis is very, very, very high. Your bone becomes so fragile and stuff. Now, what are the warning signs? Once again, like sicknesses. Like you get sicknesses easily because in the bone marrow and stuff, they have fight what they have fight diseases and stuff. So once the bones are weak, like we are predisposed to disease here now and there. Also, you get like so much pain now and then. Like, or the joint pain, you feel them easily. You like be drinking the painkillers. You know what have you, exercising and still not like trying and still not releasing for pain. So these things are the key warning signs you will find when your bones are weak.
Okay, very interesting. Oh, wait, a doctor. There's a place called Flip It. It's a trampoline park right behind my house, and I was planning to go. What if you have children and you can't get involved? So is it best to just take them to the park and watch them play while you sit somewhere?
No, see, it's very important. Like me, for example, like after 2 years or like 3 years of working, seeing people like coming to the ER. And then like telling them what happened and that made them have this fracture. I'm telling you, I'm very afraid like to do certain things in my life. I
think age matters as well, though. You're not too old.
For the trampoline, myself, or how old do I need to be? 40?
Yeah, you're not. I think I get what Dr. Blessing's saying. Obviously, when I always say this, and I was like, I'm not even trampoline. I'm scared of bouncy castles. Because of a patient that I encountered.
Exactly. Like PTSD.
It has an effect on you. So obviously, Dr. Blessing's talking from like his experience, and I say not just bouncy castles. I'm also afraid of like fireworks, especially on like bonfire night. Of the burns you get from that is ridiculous. So I'll never touch fireworks just because. But that's our experiences. So yeah.
Yeah, that's my experience. So there are things or there are sport activities, regardless how fun they are, I will never do them. For example, like climbing like a ladder and do something things, I'm so much careful. So much careful. I've seen people like flipping and having like the ankle fracture, like ankle a whole lot. So I'm very, very, very careful.
Even if pens on the floor are a big thing to me because somebody tripped on a pen on the floor and they had the most ridiculous ankle fracture I've ever seen. So I'm very, again, careful with pens on the floor, toys on the floor. This is the thing. If you work in a medical setting, you tend to be a little more cautious about,
Like, I think you do. Yeah. That is that.
Because we see all the rare and wonderful things. So I guess from a normal point of view, I would say if you're I apologize for the background. There's football in the house, and there are men in the house, so you know what that's like. But if you like, for example, in terms of age, I think usually bone health starts to go down, especially with calcium, when you hit around sort of perimenopause, menopause, the age, so like 45-ish and above. That's when you be a little bit more okay because of the estrogen as well. But I think when you're a little bit younger, you've got a little bit more. So if you do want to go on your trampoline,
this is the time, isn't it?
Yes. Once again, please, like a very big disclaimer. I'm not saying don't have fun with the trampoline, please. So say,
okay. We totally understand you. They can do it and hurt themselves if they want to, but we'll just take care of it.
No problem. I will go there and just do like tiny mini mini jumps. Yeah, that's fantastic. We've got questions coming in. This is what I, as a host, love to see. So we'll start off with OT Media. Yes.
Yo, me that's a doctor. Say, me sorry kakraba me buy no na me say na wo can be about enlargement. Can you throw more light on that side for me about bone health near now can?
Oh, okay. Now I was
Any muscles no any muscles.
Yeah.
Maybe for the benefit of bana or more hands one patch.
No, no, I was giving an example to one of it. Okay, like actually it wasn't part, but I was saying that the bone is nipa, how to increase the bone health, like exercising help increasing the or maybe a nipa who do 40 years every year we tend to lose 1% of your body mass or your muscle. So like I was into like a podcast, a doctor who is a urologist saying that one of the natural way to increase the enlargement of the male part is like exercising, and one way is like doing this like masturbation, like pulling and stuff. It helps like it is a natural way of and increasing what the male part, because now people are going to the gym to lifting and stuff to increase their muscle and stuff. The same way, they sort to say the penis is also like so it's like a muscle. So it's also a way like exercising the penis to also enlarge it. So if what you are going to explain.
Okay.
But in the same
Look,
way.
and then Busa said, since marriage is a mutual thing, would you encourage the ladies to help with the exercise or DIY?
Absolutely, I will agree with you. But as I said, yes, again. But I think in that case, please, you have to go and see your gynecologist or urologist if you have a problem. But in marriage, I think I will agree with you on that. At least that's a pleasure. Let and the men feel, So I agree with you on that. But
as a doctor.
But with a good intention, please.
But in the same way, I was saying, so you don't have to do if you're married, you can just do regular intercourse. You don't have to do masturbation. It's essentially so
basically regular use of the muscle helps it grow. But please, men, be careful as well. Don't go and be addicted to masturbation. Too much of everything is bad. But yeah, thank you, doctors, and thank you, Oti, for the question. We move on to Bright, UK. Hello, Bright.
Yeah, hello.
Hi.
Yeah, good evening.
Good evening.
Yeah, but I'm assuming doctor, my questions be about the teachings in our oil.
Patrick also.
Okay. That's it. And now kunya de mami. But my question is now or church say based on muscle building and no idea every day be a but sometimes yeah me consistency no me eja tumbia be 2 days and 3 days na minya start a workout no enti da me start say me to aso a me wi a me ti pains ewo mabati enti pese me busa ne say eno sa no me nkoso na menye gym na say mempe supplement bi a ebetimi abo my pains na reduce na say saying because nyade say I feel so nyade say me call gym ankasa me no ofie me ankasa mo metas wa no ma anopa bia me de kakra in fact masa wada another metas square na mkwan so esan ba nti ade a me focus no say me build me body na mostly na so ya wo me chest so upper part of my body nkwa me build it down into advice we obasanya mamiana that's it.
Now I would never advise you like to take painkillers just to do away with muscle soreness. And your pain, I kind of say muscle soreness. So that's why we encourage that once you start, like you need to continue now and then. Now, if you stop and you resume back, and then the pain you feel It is a natural phenomenon. It is a natural phenomenon. Do not go and use painkiller. Once you sleep and wake up a day or two, you'll see that naturally the pain will go off naturally. Meaning, if anybody has witnessed that before, but the pain will go like naturally. So I don't know any muscle pain. It is called muscle soreness because you are now reusing the muscle again. Me, for example, in case like I stand for an hour or two for surgeries, let me see, because I'm very tall. So imagine doing surgery with my boss who is short, and then like he's the leading surgeon. He tells you the amount or the level you need to like put at the table. And I'm a young doctor. I need to like screen myself and be at the level where the table is. You understand? So you see me back pain, and then trust me, whom you ask my any small work I do or any measurement I do, I'm more pain. But once I stretch, take water, move on the twist, and you see the pain is gone.
Okay.
So like, do not go and use anything. It is a natural phenomenon. Don't worry yourself about that. Just continue on building. But one thing I would advise you that continue using or like do it like regular. Do not break and come back and come. Once you break and come back, the pain will be there, which is okay. Don't worry about that.
If I can just add to that, so what usually when people break, they tend to want to go back to where they broke from, and that's also a mistake. So when you're exercising, if you're lifting, for example, let's say 20 kg, and then you stop if you stop for a day, there's nothing wrong with that. Because you are allowed to have like rest days in between gym days. But if you're stopping for longer than a day, so if you're doing like 48 hours or more than that, so 2 or 3 days, then you actually don't start from 20. You actually have to start from lower because you're having to retrain, almost like retrain your muscle. I think you could potentially even do 2 days. It might be okay, I think. But I think anything longer than 2 days, then it's almost like your muscle has to get used to it again. So that's probably a mistake people are making. Just because you stopped at 20 doesn't mean you go back to 20 because you're overworking your muscle. So you have to gradually build it up. And then
listen to him. Listen to her.
And then the second thing you mentioned about training just your top part of your body, for me, that's a complete no. You don't do that. You have to train the bottom part of your body as well. There's no point building up your muscles. And a lot of guys will tell you because I don't know why you're doing it. And I'm not saying this is the reason why you're doing it. But a lot of people would say, oh, me building my muscles on the top because then I made the shit some shit to be a fit. And the muscles popping them and stuff. But you will look out of proportion because it's almost like saying that I'm going to train my right arm and I'm going to leave my left arm. You're going to end up with muscles on your right arm and then your left arm's going to look like what's happening here. If you're training, you have to train your upper body and your lower body. As much as you might not want muscles or you might not want too much in your lower body, I'm not saying do it equally, but if you're spending an hour on your top, spend 30 minutes on your bottom. So at least you're still building something up. If not, you end up looking like Johnny Bravo. I don't know if you want to, but so that's just the two things I wanted to add to it.
All right.
Yeah, I completely agree. As an ex-gym rat, it's hard to believe, I know. But it's very hard to believe. But I wasn't a gym rat, but yeah, as an gym person, I wake up
definitely a gym rat.
Yeah. But definitely not even that, because if you're training your body on the top and like your muscles are going to be, because of your training, you're going to be heavy there. You need to be able to carry your support what you're training. So definitely you don't want to leave your bottom bit out. So yeah, you can emphasize the top, but you definitely need to give some training to your bottom. Your lower, your friend saying, body. And yeah, okay. Thank you, Bright. Thank you, doctors. And now we move on to Auntie Amma. Hello, Auntie Amma. Good evening.
Hello, good evening from Ghana.
Welcome. I was going to say welcome back, but you're not back.
No, I'm not back.
We're lovely to have you on the show. We really missed you.
I was on the show last week, but the internet kept on going and coming, so I had to just stop in and out. So I had to just switch it off. Yeah. Okay, I did ask a question, and Dr. Blessing hasn't actually answered it. I sent it directly to him.
Maybe he's giving me sorry for that. I did.
I've got 2 questions, but I want you to answer the first one. Dr. Kos, please check your phone.
Oh, this mom.
I'm not able to see my phone at the moment because I'm on like the web version of Zoom.
Okay.
Mom, please, is it possible? Maybe your question you can ask it again.
It's on your listing, Dr. Kos.
Dr. Koso Hunti Busa.
What's it mean is that? Oh,
Yeah, I mean,
okay.
I can't, I'm using the web version, so I can't do anything because I'm not at home, so I can't see. I'm not using my usual laptop, so I don't know how to operate.
You can ask it directly to Dr.
Okay,
Kos.
all right. Let me just ask the question again. It was a private question to Dr. Blessing. I just ask, please, how do you increase your bone density?
Oh, okay. All right. Okay. All right.
That's the first question, please.
Okay. You want to answer? Do you want to add the second question or after that?
No. Stage by stage, wofa. Menya body bi di wa ha.
All right. So, mommy, now, let's deal with the risk factors. If you have the normal amount of nutrient in your bone, please just do away with drinking, heavy drinking. Let me put that way. Do that away with your heavy like smoking. Like move your body, as I said, like exercise, and then have balanced diet. These things are a way to increase your bone density. Aside that, having the right amount of the calcium and then the vitamin D supplement in your body. So having the right proportion of the amount in your body. These things are the way to increase your bone density. If you are not below the threshold of the age threshold, not being like over age, and then you are within the from 1 to let's say 45, 50 thereabout, please having these things enough. But as I said, if you're above the 60 plus, the 65 plus, going to your 70s, it's okay. I know age is catching up, which will amount decrease their bone density. But once you do these things, it can help maintain the amount of nutrient of the calcium and the vitamin D, forming the bone density in your human body.
Okay, thank you for that answer.
Exercise.
Dr. Kosijadi. My second question is,
okay,
a 58-year-old with borderline osteoporosis, what are the advice you're going to give to that person?
Like lifestyle modification.
No. This one, the low bone density was caused by how do you call it? Tamoxifen.
Like drugs. Okay.
Yeah.
Okay.
Anti-cancer medication. Yeah.
Okay.
So what are the advice that you will give to such a person?
Now, this, as I said, the reason why he's taking a drug for a treatment, but it is in turn causing a different harm to the body. So now, in this case, it's I don't know, leaving the other one to do the other one. Now, between the bone density and then the cancer, I think the cancer, we weigh the cancer to be, let's say, the utmost priority than the osteoporosis. So of course, just go ahead and still take it. For example, I know doctors in internal medicine always giving this corticosteroids, the steroids for their prevention. But we, the trauma and orthopedic people, we don't usually, we always, okay, please, once you do even if there's some antibiotics that will cause, let's say, Achilles rupture. But still, we see doctors in the internal medicine still giving this prescription. They know, although they're not an expert in that, but they know, but they will still use it because once they don't do it, it is causing a different harm. Like a worst case scenario, if the person has an Achilles rupture, he will come to us. We do the reconstruction, and the patient that will be fine. So now between the cancer and then osteoporosis, the cancer is the utmost or the utmost priority. So it's still continuing to deal with it. Now with osteoporosis, now you having osteoporosis doesn't mean like it's the end of the world. You can have an osteoporosis and still live to 90 years, 100 years before you die. If you are careful, like the way if you're careful, like the way like you move with your body, that is it. If you haven't had any fracture, if you have a fracture, then that is when it become a case. Because once you're putting the nailing, you are putting the plating, the screws that cannot really hold the bones very well, and it's also like a big disadvantage. But you can have an osteoporosis at the lowest degree, at your worst degree, and then can still live to your 90 years or your 100 years if you live, or in case you live well and then know how to move your body. So the person can still go on taking the drug that he is taking, and then he still move on with his life.
Thank you. What are some of the lifestyle changes that will help someone in this condition? You said moving your body.
Yes.
How? Do you have any? Is it the whole body?
Exercise.
Or going to the gym?
Mama, any movement, so to say, any movement is a movement.
Even dancing?
Yeah. Dancing is an exercise.
Good.
Running is an exercise.
Okay.
Any way you move the body, it's an exercise. Now, in Africa, so if you say moving the body, that you mean maybe like going to the gym. No, dancing is a big exercise. Even so to say, like even sex is a big way of
Hey, doctor, me patron me you.
Mommy, like this just for
don't be sorry to say it's a fact. Say it with chest.
Okay, like this just like for like not in a bad way, but in a good way of trying to you all learning here. Even sex is a very good way of exercise. And according to research, if you ejaculate one as a man, it's like you going around like a 4 cycle of a football park, let's say like Wembley Park or any park around. It's like a standardized park. You know how the athletes after the run, yeah, in the same way of you having like one cycle of ejaculation. And I know, like you women, after the ejaculation, how your men will be panting and stuff. So yes, mommy, any movement of the body is a form of exercise, not necessarily like going to the gym. Mommy.
Okay, thank you. Thank you so much, Dr. Blessing. I'll give someone the chance to ask the question.
What was it? Tamoxifen that she talked about initially.
Yeah.
So depending on how long you've been on the tamoxifen, it's also worth asking the doctor. 9 years. So I think that it's usually 10 to 15 years.
No. 5 to 10.
No, it depends sometimes, doesn't it? So, because if you get to 10. I think sometimes it's 15, isn't it? 10. Well, it depends anyway. But that's not my area of specialty. But if it's 10, sometimes if you talk to your specialist who put you on it, especially if if it's causing osteoporosis, they might be able to take you off. Especially if it's 9 years, because it's so close to the 10-year mark, they might actually say it's okay to come off it because it's affecting osteoporosis. So it's a conversation to have with your specialist. The second thing is, depending on, now this is going to test my knowledge, but I can't remember if we give tamoxifen to people who have hormone dependent cancers.
No.
So you don't, which means you can be on HRT as well, because hormone you potentially could be, and again, this is a specialist decision, but HRT is protective against osteoporosis, because we know that estrogen levels is what causes osteoporosis in people in the menopausal ages, and the reduction of estrogen. That's why we give the HRT. But I know people who've had cancers, especially breast cancers, we don't like to give HRT. It might be a contraindication. So sometimes, again, talking to your specialist to say, this is the issue. Because what we have to understand is when the specialist is treating breast cancer, they might not know that you're the person is suffering from osteoporosis, or that so you need to tell them that this is the situation, and then they can adjust your medication or your treatment accordingly. So that would be my advice to you as well.
Thank you so much, Dr. Akusma. Feel power.
Always here for you.
Thank you so much, Dr. Blessing. I'll allow someone else to ask questions.
Sure.
And then I'll come back.
Again?
Yes, Amma wants more.
I think I'm gonna sign out now because, like I said, I'm not at home. I'm actually visiting a family member, so I'm in a bit of a noisy place. So I'm just gonna say bye, guys, because I was trying to be on, but I think I'm causing more disturbance than I am doing anything. So
You're actually supporting, which is actually quite helpful. I think you should stay in the background just in case you're needed.
That's fine. I'll turn my video and I'll be in the background. If you call me, I'll come and answer. But if not, thank you all for being here, and I hope to see you next week. Bye.
Thank you, Dr. Rose, for joining. So, okay, Dr. Blessing. Thank you, Auntie Yama, for your questions. And any more? If not, we'll go straight into Dr. Blessing giving us recommendations. Okay, Dr. Blessing, I think Auntie Yama, if you have more questions, you can go ahead and ask. If not, we'll start closing the show, and we'll get Dr. Blessing to give us his last few words.
Yeah, okay, good. You did say something about calcium and vitamin D. Can you? I just want to know the dosage for someone with borderline osteoporosis.
All right. Now, like in my presentation, I was talking about the adequate amount of all these supplements, like to take. Like, I didn't give the amount because, like, in every country, like the protocols are different.
Okay,
but for the benefit of the doubt, the vitamin D, like 1,000 IU a day, and then with the calcium coming from 1,000 to 2,005 IU a day. So
okay, just wanted to find out. You said vitamin D. I didn't hear you mention K2, and from my little knowledge of vitamin D, the absence of vitamin K2. I mean, if you add vitamin K2 to vitamin D, it really helps with the absorption. It absorbs very well.
Yeah.
You know, it helps with the it absorbs very yeah. So what I want to find out is you didn't mention K2. Why?
Okay. So
please.
Now, yeah, I didn't mention K2 because in my like preamble, I was like I love to stick to the topic that I was giving. But in case you want me to elaborate, I could elaborate. I remember, like, Abena asked a question and I was like, taking one vitamin alone will not do the justice to the other. Like, vitamins work hand in hand. So, like, you taking this one without taking the other one, like you have the full glow of the use of one particular vitamin or one particular nutrient. So they should go hand in hand. So I did not mention the vitamin K because it wasn't part of the topic that I was given. But yes, you are 100% right. Taking the vitamin K helps in the reabsorption, especially in the intestine, to absorb the vitamin D or the calcium. It helps faster reabsorption to activate the nutrient to work or to have a full absorption in the human body. So you're absolutely right. Taking vitamin K helps in the reabsorption of the calcium and the vitamin D.
Okay.
Right.
Okay. Thank you. Another question I want to ask, because nobody wants to ask these questions, but we've got loads of things going on. So I will ask for everyone. What is your advice to especially the Black community or the African community when it comes to vitamin D? Because in Ghana you get loads of vitamin D, so you don't need it when you know. I've come to pinch some from here, but that's fine.
Yeah.
We don't get much sun in the, I mean, wherever we are. What are your recommendations? Do you think that, would you advise everyone to take vitamin D, or you think they should go for a test before they start taking vitamin D?
Okay, mommy, if you say that, okay, in Ghana, of course, the vitamin D, we have a natural vitamin D. Mostly, we call it like the sun sign vitamin D. Doing back home, during our time in medical school. So yeah, I agree with you. In Africa, we get vitamin D purely from the morning sun around 7:30, 8 o'clock, that about. But if you're telling me here in Europe, like we don't get the vitamin D, I don't agree with you. Like we don't have the winter throughout the entire year. Of course, even sometime in winter, you are going to work and you see that there is sun. This it's like a rainbow. This is not a rainbow. You see the environment is so shiny. You see why it's sun over there. That is a good way of vitamin D. Nevertheless, in spring and in autumn or even in summer, there's not snow like throughout the year. There is a little bit of sun, and even in summer, there is within like 3-4 months of sun. It is that early sun is a very good way of having vitamin D. So, sorry, I don't agree with you that here in Europe we don't have vitamin D. We do get the vitamin D as all the signs of vitamin we get it. Now, if you're not getting a vitamin D because maybe you think like maybe you're always indoors and stuff, I advise you, of course, not necessarily like going to your GP or your doctor. Oh, doctor, I think I have a low vitamin D, so please give me a supplement. Please start from your diet. Start from your diet, the veggies, your milk, your cheese, and all the food that gives us the vitamin D or the calcium. Just have it. Our bones, like we chew them, and our red meat, we should chew them. First, let's start from there. Do not go straight away to the pharmacy. Do not go straight away to your doctors, like having them or complaining about vitamin D deficiency or your calcium deficiency. Let's start from the home. Let's start from our kitchen, and then we can move forward. If you think maybe, I know that some of us maybe like cooking is very difficult for us. Me, for example, like work issues. Sometimes, like from Sunday, trust me, I've never had the best food to eat. Always in a rush, doing some shabby food to eat just so I can occupy my stomach to go and have work to do. So I agree with you. In case maybe like you don't have the time to cook or time to prepare your food in the house and stuff. In that case, sometimes like visitor. But if you have the time to cook and eating very very well, I don't need visiting the street people. Trust me, I'm a doctor. But I'm someone who do not believe that, okay, like the drug or the medicine is the sole treatment of our life. Sometimes let's take from what we put in. We know the Bible, what the Bible said, like
Genesis 1:29.
Exactly. Thank you very much, mommy. So sorry to say, anyone who doesn't understand English, I was like, the Bible said that we should eat the fruit and use the leaves to like for cure. So like look that way, like go in your kitchen, all the medicine in the kitchen. Now I want to give you one secret in medicine. Every disease or every treatment that you have, or disease that you have, once you go to the doctor, the first thing, or even mainly our books that you read before we come here to teach or we go to the hospital to prescribe whatever we need to prescribe, there's something we call lifestyle modification. Like it is the foundation of treatment of any disease. Lifestyle modification. What do I mean lifestyle modification? How go about your daily life. It's about what you eat, how you move, and how you do your things. Regular bathing, maybe like cleanliness, like how you brush your teeth, how you comb your hair. Lifestyle modification is very important. Like it's basically the foundation of everything we find ourselves in this world. So let's start from the kitchen. Let's start from the lifestyle first before we go and then see our GPs, our doctors.
Okay. Thank you, Dr. Blessing. I'm going to react to some of you. You said something about yes, the sun that we can't say, how do you call it? That I know the our skin is quite, penetration is very difficult, the sun. So we can't compare ourselves. And how many of us go out there? So, yes, I do understand what you said, but how many of us go out to meet the sun? I want you could. So I do understand. The second thing is you said something in tree, and I quoted Genesis 1:29, and I'm reading from the TPT. And God said, I give you every seed bearing plant growing throughout the earth, vegetables and every fruit bearing tree with its seed within itself. They will be your food. Thank you. Amen.
Amen.
Okay, back on to my next this thing. I know we are not talking about nutrition, but it is based on what you said and what I've just read in the Bible.
Okay.
How do we boil? Yes, we've got to we peel a lot. You see, there are some practices that we do which really affect the food that we eat. Already now, the chemicals near yan near Adrianina, like plantain. When I was growing up, my mom would not boil plantain with the without the skin. The skin is on, and then she will boil because she believes that that is where the nutrients are.
Yeah.
Our potatoes, our sweet potatoes, we tend to peel them. Even our carrots, we tend to peel them. Which, when you peel it, you take, the nutrients away. And then when we boil our how do you call it, our vegetables, anything you boil, I know people tend to say I steam, but again, let's say you've taken a carrot, you've grated the carrot. Yeah, when you taste it, it's quite different. When you boil it, what is your nania?
Yeah.
You shouldn't use water. I take my mixed vegetables from the freezer straight into my, thank God I've got salad master. I've had it for almost 20 years. I put it in and then on low heat, and then I put it on the fire and I eat it. I don't use water. And it really cooks because I cook on low heat. So there are certain things that when we advise people, eat your vegetables. How are we cooking our vegetables? That's a big question.
Okay.
Because we don't get all the nutrients. I know we are not in the nutrition, but based on what you said and what the Bible said, thank you.
Like and then I love for that. Maybe if somebody, I don't know, but I'm really loving the discussion how it is going now about how to boil vegetable. Now, mommy, see, like regardless how you advise people, they will still do what they think it is best for them or what they believe it is good. Trust me, in my life, I have never steamed vegetable before. I mean, I'll boil it. You understand? It is good. Now, there's a risk. People believe, even back home in Africa, okay, like in case like you boil the vegetable too much, you losing all the nutrients in the vegetable. Me, I've never done any research on that, or I've never seen people saying that. So me, on that aspect, I do not. There might be an iota of truth in what people are saying, but I personally have not done that. Now, how should like people boil their plantain, stuff? I ate like potatoes with the peel on when I got to Europe. To be honest with you, in back home we just take off the thing and because them say that you need to wash and stuff. But I come to realize, okay, this is how people do it here, and the people and that way like people get the full nutrient and stuff. Now back to the question, how to boil the vegetables and stuff. I cannot tell, okay, like boil it for 5 minutes, boil it for 10 minutes and stuff. Like people like even egg, like people want it well cooked. People like it like when there is me on that yellow, that the yolk aspect, when it's not cooked, me blessing, I cannot eat it. Me, I'll be honest with you. Like if the egg is not well cooked, me, I cannot eat that. That when the yolk is not really cooked, me blessing, I cannot. And I love to eat egg. I love to eat egg, but I'll make sure like it is boiled. And I can, once you eat it, of course, maybe you get a full nutrient, but of course you have some still remaining nutrient left. So, Mama, how people should boil the vegetables is a preference, but now the bottom line is like eat your vegetables, eat them, whether it's well cooked or undercooked or medium cooked or well cooked. How well the person will boil it, that's one I think it likes a preference. And I'm not like me here. I haven't done any research to say okay, boil it for 1 minute, okay, like steam it, okay, like do it this or do it that. I haven't done anything, and then blessing me here, I won't say anything that I have never done or read about it. So on that aspect, I cannot give you a vivid answer. But now the bottom line is that eat your vegetables. No matter how you cook it or how you boil it, please eat the vegetables. Thank you.
Thank you both. Wait, I have to interject a little bit. I know, Auntie Amma, you are willing to speak more, but there are questions coming in, and time is fast spent, so I'll try to get through them as quickly. But I've got 2 questions in the chat. I think I will take the 2 at once. I think one of them is just a simple yes or no answer, which is if you take vitamin D during the winter, do you need to pause in the summer? And what causes knee crepitus? Have I said that correctly?
Yeah. Yes.
So,
okay. So, like, you can do the answer first, Abena?
well, if you take vitamin D during winter, do you need to pause in the summer?
No, like, don't pause. If you're taking it for a reason or for a cause, I think like you should just continue, but do not have it overdose. Just continue to take it.
And then the next one, which is what causes knee crepitus.
Okay, now it's called I don't know. Yeah, it's called. There's like a popping sound like in the knee, not only the knee, or like every joint. Sometimes we scrape our hand, we hear pop. Now I want to make like our joint move freely. It's like a fluid. It's called a synovial fluid in the joint. Every joint you find in our body, there's a fluid in them. Now it's like our cars that we have. We know how we can turn our steer, how we can move our car is because like there are joints in the car, and then like in the joint there are some fluid in it. That's how we have to go like a brake fluid and all these things that in our cars we buy them. So now what causes it? Now mostly in the knee, like once we squat, we hear this like pop, or once we bend our knee, we hear like mostly like this sound. It's because like the fluid, because we bend it, is like a force that is causing or that fluid causing the popping sound. It's nothing. So if you haven't had any fracture, if you haven't had any accident or a fall, and once we hear this popping sound or this like crepitus in your knee or in your joint, it is something called it is a natural phenomenon. It's because like the water or the fluid in it is trying to like move or like find its way. It's like you putting water in the bottle and they're trying to move it. This. Once you're pulling water from the bottle, this how the bottle moves. Like the water is like finding a way to like get out of the bottle and then making that sound. It's the same thing in the knee or like any joint we find ourselves, and the fluid in the joint is trying to like find way and move. And that's why it's making that sound. It's nothing. It's nothing harm or nothing harmful. Nothing in the big deal. It is a natural phenomenon. Unless maybe you've had a fall, and that in that case you need to go see your GP or your doctor to examine you. But if you haven't had any fall, any accident, and then everything okay, that sound is a natural one. Don't have any or don't feel anything bad.
Okay, we'll take the last few questions, and I think I'm not taking any more questions after that. So I'll go to Auntie Liz, who's got her hands up, and then I'll come to the last 2 questions in the chat, and then that's it, unfortunately, guys, because time is fast spent.
Thank you, Dr. Ada. I know you're tired. You look tired, so I wasn't going to ask any question, but if I don't, Auntie Amma won't stop. Therefore, I'm going to ask my question. And before I do, I know she's going to fight me, but hey. Before I do, Dr. Blessed, even people in Ghana are lacking vitamin D because they don't stay in the sun. The way you describe it, the early morning one is the good one, they won't stay in. And so people are still suffering from lack of vitamin D in Ghana. Maybe you don't know, but it's happening.
Now, although people are having, or we having the sun in Ghana, but people are still having issue with vitamin D.
Mm-hmm.
One is because maybe they are not having the right amount of nutrient, and then like we all know that back home in Africa or back home in Ghana, people are even struggling like to have like a full, like a 3 square meal a day and stuff. Me, for example, I come from the village. People know that I'm from the Western North. I'm from Sebi. When I moved to Europe, like when I saw my friends drinking like Lipton in the morning, like when I went to class, I was like, hey, what is this? I mean, in the morning, I left Bangkok or the left Bangkok that we cooked the following night is what we eat for breakfast and then I go to school. People, eating this like stuff and stuff. Hardly do we eat them in Ghana or having somebody, having a well-balanced diet in Ghana. This like economic issue and stuff. So
No, that wasn't my question though.
Okay, please, question again.
My question is, you said the hip bone is like a beam, which is the strongest. How come people get hip replacement all the time? How come it wears off all the time? If it's the strongest, what's happening when people need hip replacement?
Okay. So why do people still get like hip fractures if it is the strongest bone, right?
Yes.
Okay. Now, like it is strong, but some mechanism or some accident or some trauma are stronger than it. Now, even like metal like is the strongest, or metal is very strong, but there's an instrument that can counter metal or cut like metal. So because it is the strongest doesn't mean like something like like counter it. Okay.
And one last thing, the way you want your name pronounced is old school. It's like when my mom was starting school, they would put the surname first and put her first name at the end. So you see, most old people before now, I think it's changing due to whatever. So you see that their surname are always pronounced before their first name. So please, Dr. Blessed, say your name, your first name, and then your middle name and your last name, Dr. Prah. Yeah, thank you very much. You are so sweet, but today you were on Nana Kwame's side, so I'm a bit... for somebody who is a single that was thinking of finding you a wife, your examples were too...
Oh, please.
Please, this wife conversation, blessing, continue it.
Please.
Nana Kwame never put his hand up.
Auntie Liz, please. This is a backdoor conversation. Let's kindly close it because
please, Abena, do you have like Auntie Liz number? Please send it.
I can connect you after. Don't worry.
All right. Then let's move. After that,
let's move. Wait there, Dr. Bonnie. Show my last two questions because I try to be a nice host and try to get as many questions answered in the time frame, but we have to understand that our time and our production,
Sure.
So okay, can you take vitamin D in an empty stomach?
Okay, some, but please I recommend no.
Okay.
Do not take it on an empty stomach. Please eat something before you do it. Please.
Yeah. And the next one was, would you recommend omega? Auntie Emma, I believe you're saying omega-3 to a 50-year-old.
Yes, like vitamins or minerals like have no limit. Have no age limit. unless the patient has like a predisposing like condition that is not like giving or like allowing that person to do it. But if everything on a normal days everything is fine, minerals or vitamins have no age limits.
Fantastic. Thank you, Dr. Blessing. So this one there, quickly, just for someone who's looking to build your bone, friend, it's a long-term bone health, and all of us here, what would be the most important sort of message you'd like for us to remember?
Okay, please. There are like people feel like, okay, like drinking and smoking is a thing that give them the joy and stuff. So like, I can't say, okay, don't drink at all, don't smoke at all, but please reduce the smoking, like reduce the drinking. There are things like you don't see it as it's normal, but please, there are some factors that are accountable. Heavy drinking and heavy smoking. It's a very way of like causing or like reducing like bone strength. It's very, very like common. So please do away with all this lifestyle modification. Please turn it down and stuff. One particular side is like, take your minerals, like please like move your body, like have your well-eating diet. And then in case you want to take any minerals or any medication, not only minerals or vitamin or D or calcium, any drug you want to take at all, please see your GP and have the right amount of dosage, because too much of everything is bad. You can take a medicine and just to treat yourself, but in the long term, you are hurting yourself one way or the other. So please, this is my close-up. This is my last message for you. Please, lifestyle modification, eating or like cook from the kitchen. Eat from the kitchen. I'm not saying say eat from the kitchen means you need to every day cook. Sometimes go out, the restaurant and stuff. But what I'm saying is that have the balanced diet. Have your nutrient taken, which is very, very important. Thank you very much.
Thank you very much, Dr.
Please, now don't forget Auntie Lizzie's number. It's very.
That's why I want to close early so that I can get the platform for the two of you to continue. Yeah. So you have to help me finish so that you guys can continue where you stop from. But yeah, no, as always, thank you very much, Dr. Blessing, for helping us understand calcium and vitamin D support for healthy bones. It is a reminder that small daily choices can make a big difference in our long-term health. And like the doctors have been banging on about exercising and you're eating, particularly very natural things as possible. So thank you so much. It's always a pleasure to have you on the show, Dr. Blessing.
Thank you very much.
I know you are very eager to talk to Attilis. Hold on. Hold on a minute for me. But yeah, and thank you, and thank you to our faithful watchers and our faithful audiences for being here. Just a reminder that tomorrow is a time with Taptap Send, same time, same link. Please do join. And then on Friday is Ask the Lawyer. So please come in as I think there's a new 10-year UK immigration assembly. Things are changing, so please just come on and ask all your questions. And a special thank you to OT Media and our sponsor Taptap Send. Have a good evening all, and see you all next week, same time. Thank you very much.
So physical money and put me to wrap just for me send in a minute in Sabakandia and then one Taptap Send.
Yeah, Ebusianfo, Bidin did an akuma patchlewa 1. They recommended Taptap Send, Mama. And that's all for